Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Diflunisal. Its brand name is Dolobid. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Diflunisal is a non-steroidal anti-inflammatory drug that also has antipyretic or anti-fever properties. It works by inhibiting prostaglandin synthesis, which results in an overall decrease in prostaglandins. And prostaglandins are a mediator for pain and inflammation. In terms of indications for use, Diflunisal is indicated to be used in the treatment of mild to moderate pain, and it can also be used in rheumatoid arthritis as well as osteoarthritis. Now, before somebody was to use Diflunisal, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Diflunisal or any other component of the product, they would not be able to use this medication. This medication cannot be used for post-operative pain management after a coronary artery bypass graft surgery. And if somebody had an asthma type or allergic type reaction using another NSAID or aspirin, they would not be able to use Diflunisal. Now, in terms of precautions, if a patient had cardiovascular disease and they used Diflunisal, they may put themselves at an increased risk of experiencing a cardiovascular thrombotic event, such as a myocardial infarction or heart attack, as well as a stroke. Diflunisal is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population unless other pain medications are not effective and they're also able to use a gastroprotective agent such as a proton pump inhibitor, as we discussed in other episodes. This is mainly due to an increase in risk in gastrointestinal bleeding or peptic ulcer disease. Patients should be made aware that anaphylactic reactions have occurred after patients have used Diflunisal. They should also be made aware that fluid retention or edema is a possibility with this medication. If somebody has hepatic or liver dysfunction and they use Diflunisal, they may be putting themselves at an increased risk of experiencing renal or kidney toxicity, as well as hepatic injury. This medication may cause new onset or worsening of hypertension or high blood pressure, and there also may be an increased risk of developing heart failure while using this medication. The use of Diflunisal is not recommended in advanced renal or kidney disease, and patients should watch out for some rare dermatological skin reactions, such as Stevens-Johnson syndrome, as well as toxic epidermal necrolysis. And lastly, patients should be told that visual changes have been reported with the use of NSAIDs. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Diflunisal, they can expect to receive their dose orally. If somebody is using Diflunisal to treat mild to moderate pain, they would typically start off with an initial dose of 1,000 milligrams, just giving as a single dose. Then they would use 250 to 500 milligrams every 8 to 12 hours. In rheumatoid and osteoarthritis, patients may use 500 to 1,000 milligrams daily, given in 2 divided doses. The maximum dose would be 1,500 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Diflunisal, so I'll go over some of those here now. We mentioned fluid retention. Some patients may also experience a rash. Up to 9% of patients may experience this. Up to roughly 10% may experience abdominal pain. Up to 3% may experience constipation, and up to 9% may experience diarrhea. Flatulence, indigestion, nausea, and vomiting are possibilities with this medication. And some patients may experience a headache, dizziness, insomnia, or somnolence. Now, some more rare but serious side effects would be the dermatological side effects we mentioned, such as Stevens-Johnson syndrome and toxic epidermal necrolysis, a myocardial infarction or heart attack, as well as a gastrointestinal hemorrhage or bleed. Some patients may also experience bronchospasm as well as angioedema. That's all we're going to talk about today with Diflunisal. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.